Alrighty, so now we're going to be talking about feline diabetes. Okay, so we have done the blood test and we've checked some urine and it looks like Fluffy is diabetic. Now, of all the diagnoses that we could make for a kitty that's drinking a lot and peeing a lot, diabetes is one of the best ones that we can make, because as long as we get this controlled and as long as we do what we're supposed to do, she is going to live a normal lifespan and she's going to do absolutely great with this. This is a good diagnosis.
Great.
So let's start at the beginning. Are you a doctor or a nurse, or do you have any diabetics in your family? Do you have a lot of experience with this?
It's all new to me.
Okay, all right, very good. Then I will start at the beginning. Diabetes occurs when either the pancreas stops making insulin or the body stops responding to insulin. Now, insulin is a hormone, and what it does is it's made by the pancreas, and it allows sugar from the bloodstream, from the food that we eat, to get out of the bloodstream and get into the cells. So the signs that we see in a diabetic that we say these are high blood sugar signs, a lot of them are actually due to the fact that the cells are screaming for sugar. They can't get it because it's all stuck in the bloodstream. We can't measure sugar in the cells, but we can measure sugar in the bloodstream. That's what we measure. And hers came up at 500, so we know she's a diabetic. Normal is between 80 and 120, just like a person. So it's real high. Not a great surprise there. And what will happen is when it gets really high in the bloodstream like that, it'll spill over through the kidneys and get into the urine, and that's why we see the high in the urine. That's why you've been feeling that real sticky on the urine. That's because of sugar in the urine. So in humans, diabetes falls neatly into one of two categories. We call it type 1 or type 2 diabetes. You've probably heard of that. Type 1 diabetes is the little kid kind of diabetes, and that is where the pancreas just shuts down and says, that's it, I'm not making more insulin, I will never make insulin again, I am done. And so these kids are kids that we have to replace the insulin because they can't make it, so they either get the shots or they get the little insulin pump, and they're on that for the rest of their lives, and they check their blood all the time to make sure that they're getting the right amount of insulin, and they do really well with that. Type 2 diabetes is kind of what they call the old man kind of diabetes, where there's been so much sugar, carbohydrates throughout the whole life that eventually the body just says, you know, I'm not really listening to this insulin anymore. There's been so much ups and downs that the pancreas is still making some insulin. It might not be enough insulin, and the cells just don't respond to it the way they used to. So again, the blood sugar goes up. And we used to think that cats also would fall into just that type 1 diabetes like dogs do. Cats are a really odd hybrid of the two, so we'll get to that in a minute. Cats are the weirdest diabetics on the planet. So cats always begin as type 1 diabetics because what cats really have is what I call pancreatic exhaustion, which is, it always happens to the nice chubby kitties, and they've had usually fairly high carbohydrate food their whole lives. They've been carrying extra weight around. Eventually the pancreas says, you know what, I'm done, I can't do this anymore. But here's the fun thing about cats. We're going to give the insulin because the pancreas isn't doing it. We know that from this high blood sugar. So we're going to go ahead and we're going to start her on some insulin. But here's what's funny about cats. If we can replace the insulin and if we can lower her need for insulin with a diet change, what happens in, I would say probably 60-75% of cats is eventually her pancreas will say, you know what, I think I'm okay now. I've had some time to rest. I'm going to start making insulin again. So we can take a cat that needed insulin and turn them into a cat who doesn't need insulin anymore by doing what we're supposed to do with diet and insulin to give the pancreas a chance to rest. So here's why that's important. Back in the old days, what we would do with these kitty diabetics is we would start them on insulin, and we would start them on a really high fiber food. And the goal of that would have been to slow the gut transit time to keep the blood sugar kind of normal throughout the day. And that's what we used to do, and when I first graduated, that was what we did. And so for a kitty her size, we would start her on a low dose of insulin, but eventually she would need probably, 6, maybe 8 units of insulin for a kitty her size. What we don't know is, when's her pancreas going to say, you know what, I'm all right, I'm going to take over this job again? We don't know when that happens. That could be in 3 months, that could be in 6 months, that could be in 2 years. But at some point, it would happen. And here's what would happen. We're giving 6 or 8 units of insulin, which is a lot of insulin for a little cat. The pancreas, unbeknownst to us, says, I'm okay, I got this, and starts making her own insulin. So now we have twice as much insulin as we're supposed to have. So what does insulin do? It lowers the blood sugar. So now our blood sugar gets low. And what would happen with these kitties is at some point, they would have a major sugar crash. What does that look like? And I'm going to tell you what that looks like. It is not going to happen to you because we're going to be really careful, and we don't do it this way anymore. But here's what it would look like. They get really kind of loopy. They get really kind of wobbly. They always seem to go to their litter boxes. They want to lay in the litter box. I don't know why. If it gets really bad, they'll get really shaky and trembly. If it gets really bad, they'll have a major seizure. If it gets really, really bad, they will die. And so what used to happen is people would come running and screaming in here with a cat that's flat on their back in the litter box. We'd give them some sugar. Their sugar would come right back up. And now this is a cat that doesn't need insulin anymore, but we didn't know about it. So that's what used to be dangerous about treating these diabetics. Here's what's great now. We have a special food. And the food is made by Purina, and it is called DM. And we call it the Catkins diet. It's like an Atkins diet for cat. It's super, super, super low in carbohydrates. Carbohydrates are metabolized into sugar. So the less carbohydrates we have, the less sugar is in the body, the less insulin we need to give in order to cover that amount of blood sugar. So what that means practically is a kitty her size, we might get up as high as 3 units, but probably we're going to be on maybe 1, maybe 2 units. So that when her pancreas, in 2 months, in 6 months, in a year, I don't know, says, I'm okay, I got this, I'm going to make some insulin again, we're only giving a couple of units of insulin. So she's not going to have a major crash. We're going to be checking her sugar every now and then, and we're going to see as it starts to go lower, eventually we may get her off of insulin completely. And I would say probably 60-70% of my diabetics, as long as we feed this special food, only this special food, a lot of them eventually do get off insulin. Sometimes they go back on again at some point, but a lot of them are off of it forever. Wow. The diet is key. It's probably the most revolutionary change since I graduated. In the 17 years I've been practicing, this diet has changed everything about cats. It's made it much, much, much simpler to treat them. It's made it much, much, much safer to treat them. So we're going to make this change. It comes in dry and canned, and here's what I like to do. I like to leave the dry out all the time so that they can nibble and snack whenever they want to. And then when it's shot time, I like to use the canned version and do a couple of spoonfuls of that can, and that does a couple of things. One, that makes them run to you when it's insulin time because they want that canned treat, and they don't care that you're giving them the shot. They come and ask you for it. You don't have to be pulling them out from under the bed to do their shot every time you have to do it. And the other thing is it lets you see that they're eating. Because with cats, they just kind of nibble all day, and it would be really easy to not realize they're not eating for a couple of days. If you're doing canned food twice a day at shot time, you can tell if she is eating. If she ever doesn't eat, if she gets, a sinus infection, if she gets a bladder infection, if she gets something that makes her feel kind of sick, if she doesn't eat, then she doesn't get her insulin shot. Because what do we need for insulin to work? We need blood sugar because it's going to lower the blood sugar. If the blood sugar is already low because we're not eating and now we give insulin, now it's going to get too low. So high blood sugar, okay, high blood sugar will give us this kitty. This kitty is drinking a lot. This kitty is peeing a lot. This kitty is losing some weight and not looking great. But I will tell you that with this blood sugar, she's probably been diabetic for a couple of months already. It takes that long to really realize what's going on. So a kitty with a blood sugar of 500 looks like this, which is okay. A kitty with a blood sugar below 20 is laying in the litter box having a seizure. Completely not okay. So high blood sugar is okay. Low blood sugar, very much not okay. So keep that in mind as we talk about what we're going to do with the insulin. High blood sugar, okay. Low blood sugar, not okay. So insulin comes as an injection. I'm going to teach you how to do it, and it's really, really easy. And you're going to do 2 shots a day, as close to every 12 hours as you can manage. Now, you do not need to change your whole life for this. You don't have to, not go out to dinner with your friends and not go out on the weekends. Live your life, live your normal life. We're going to do 2 shots a day, as close to every 12 hours as we can get, never within 8 hours of each other. We like to pretend that insulin lasts a full 12 hours. It really doesn't. So as long as it's not within 8 hours, you're fine. So let's say you're going to go 6 and 6. I don't know what time you're going to do. Doesn't matter what time you do, whatever works for you and your family. But let's say we're going to go 6 and 6 for our insulin shots. So we get up in the morning, we give our 6 a.m. insulin shot, and then what's going to happen is the blood sugar is going to drop. And the kind of insulin we're going to put you on, about 4 hours or so after that shot, that's going to be our lowest blood sugar, because that's going to be when the insulin is most active. It's about 4 hours after you give it. That's the blood sugar I care about. I don't care about any other blood sugar, any other time of the day. I care about that blood sugar, because I care how low it's going. Because remember, low is dangerous, high, they don't look great, not super dangerous. So that's when I'm going to want to see her from now on, is at that time, 4 hours after your morning shot. So we give our shot at 6 a.m., and then 7, 8, 9, about 10 a.m. is when I will want to see her when we do our blood sugar checks. That'll be the low time. Then it'll start to creep back up, creep back up. So let's say it's Friday night and you gave your shot at 6 a.m., but you're not coming straight home after work. You're going to go out to dinner with your friends, so you're not going to be home at 6 to do the 6 p.m. shot. Okay, that's fine. You get home at 8:30, you get home at 9:30, that's fine. Do your shot then, no problem. Everything is fine because we're as close to 12 hours, but we're not within 8 hours. So if it's a major party night and you're going out straight after work and you don't get home until midnight. So, okay, you can do your shot at midnight, that's fine. But don't do your next morning shot at 6 a.m. because that's too close together. That's too close to a midnight shot. That's only 6 hours. Wait your morning shot. Wait it back 8 a.m., 9 a.m., 10 a.m. You can fudge it a little bit early. You can fudge it a little bit late to plan for how your schedule is going to be. And I will tell you this story, and I always tell this story. I had a client who was a nurse and worked crazy nurse hours. And her mother was also quite ill in a nursing home. So in addition to her crazy nurse hours, she was also going to visit her mom and taking care of her mom. And what ended up happening is her diabetic cat was only getting 1 shot a day. And that cat probably only got 1 insulin shot a day for probably 2 years until, unfortunately, her mom finally did pass away and her schedule became a little more normal, and then she went back on her 2 shots a day. During that probably 2 years that the kitty only got 1 shot a day, he didn't look great. He drank a lot, he peed a lot, his sugar was kind of all over the map, but he lived and he was okay. And when her schedule settled down and we were getting our 2 shots in a day, sugar came right under control and everything was absolutely fine. So don't freak out that, oh my God, I missed a shot, the sky is going to fall. The sky is not going to fall. And don't think to yourself, my life is over, I can't go out with my friends, I can't see my grandchildren, I can't. Live your life. You're going to do the best we can with this. Remember, high blood sugar not dangerous, low blood sugar dangerous. So what that means is, if you're ever not sure if you did the shot right, if sometimes you go to put the needle in and they move and you go, oh my gosh, I don't know, it's a tiny little needle, and it's a tiny little amount. So you go, did I give it or did I just squirt it on him? I don't know what happened. Or Jim gets up before you and maybe he does the shot and then goes off to work, but you don't know because he didn't write it on the sheet and so you don't know. It is much safer to skip a shot than it is to double a shot. You can skip a shot if you need to. That client of mine, she skipped shots for a year. Cat didn't look great, but he survived. So if you're in doubt, if you go, I don't know if it happened, I don't know if he did it, I don't know, don't ever double a shot, skip a shot. If you're in doubt, assume it was given, assume it happened, skip it. Totally fine, nothing bad will happen. So it's close to every 12 hours, never within 8 hours. If you're in doubt, do not give it. And the best thing to do is, like I said, a couple of spoonfuls of this canned DM, this special food, and they'll come running, and they stick their face down, and they start to eat, pop that shot in while they're eating. They don't even know you're giving it, and it's super easy. So insulin. Insulin is a human drug, so I'm going to write you a written prescription. I don't keep it here, and you're going to take it to Walmart. And even if you don't shop at Walmart for anything else, go to Walmart for this insulin because they have a special kind of insulin called NPH. They have their own house brand of it, and their house brand is about $30 for a bottle of insulin, and that's going to last you probably 4 or 5 months. If you go anywhere else but Walmart, the exact same insulin is like $85 a bottle. Oh my gosh. So it's so incredibly much cheaper. It's totally worth it, and it's a fine product. It will work just fine. I've never in 17 years had a cat that I could not control on NPH insulin. There's lots of other kinds of insulin. There's a lot of really fancy insulins, and they're awesome and fantastic, but they're like $120, $140 a bottle, and there's just no reason for that. So we're going to start you with this Humulin NPH insulin from Walmart. I'm going to write you a script, and I'm going to write and syringes on the script. They're going to give you the syringes. And here's what I want you to do. When we're all done talking, I'm going to have the nurses come in, and they're going to show you how to do the shots, and they'll teach you how to draw it up, and they'll teach you all of that. But what I want you to do is when you go and you get your bottle of insulin and your syringes from the pharmacist, have the pharmacist show you where on your syringes is 1 unit. We're going to be starting with 1 unit because they're different on all the syringes. Sometimes it's like 1 little line, sometimes it's like 2 little lines. It just depends on the syringe. Have them show you where 1 unit is because you need to make sure it's a teeny tiny little amount. It's literally like this much on the syringe. You're going to be like, I can't even see that. It's so little. But you have to get it right because the difference between 1 unit and 3 units, it's only that much, but that can make a huge difference in your blood sugar. So just have them show you where 1 unit is because it might be different than on the ones that we're going to show you. Okay. Keep your syringes at home. Keep them in a shoebox or a coffee can or something like that. Bring them to me and I will dispose of them for you because you can't just throw them away in the garbage. The Rumpke guys get very upset with used needles in the garbage. Don't do that. Bring them to me. I will take care of them for you. So here are some tips about insulin. Insulin lives in the refrigerator, and insulin will settle out in between your 2 shots. So when you get it out of the refrigerator, It'll have kind of settled and you'll be able to see that. And you're going to roll it between your hands. You don't ever want to shake it hard. You'll kill that insulin molecule and then it won't work anymore. So just roll it between your hands and then you're going to draw it up and we'll teach you how to do that. And what I always suggest is open your refrigerator door, stand inside your open refrigerator, draw it up, set it right back in the refrigerator, and then close your refrigerator. Because if you don't do that, what's going to happen is someday you're going to get it out and you're going to be on the counter and you're pulling up your insulin, and then the phone rings and then somebody's at the door and then the dogs are barking and then everything goes crazy, and with one thing or another, you're going to get home from work that night and you're going to see your bottle of insulin still sitting out on the counter. Now it's probably not good anymore, and now you probably have to buy a new bottle of insulin. So that will never happen if you always just stand in the refrigerator. You know, it's going to take you 3 seconds, pull it up, and just keep it in there. And that means you don't have to keep buying bottles of insulin because you accidentally left it out. So that will help. So when am I going to check? Here's what's great about cats. Cats eat what we give them, and cats do pretty much the same thing every day, which is pretty much nothing because they're adult cats. So what's hard about human diabetics is last night I went out to dinner, and this morning I had breakfast cereal, and I'm going to probably go home for lunch and have a lean cuisine, and then we're going out for dinner tonight. I eat something different every single day, and today I worked, and tomorrow I'm going for a bike ride because it's my day off. We do different things every day, different activity, different food, different everything. So if I were diabetic, I would have to be checking my sugar and checking my sugar and checking my sugar because the supper I ate last night is different than the supper I'm going to eat tonight. And the activity today is different. So that's why people have to check and check and check and check because it's different every day. Once we figure out how much insulin we need for this kitty and this food, which is going to be the DM food, once we sort that out, then we're pretty much going to have it. So you don't have to be checking at home. I will check here, and it's only going to be every week for the first little bit. We'll back off to every couple of weeks. Eventually, it's going to be probably 4 times a year that I'm going to check as long as everything is fine. So yeah, it's so much easier, and we're just going to be using these really, really, really small amounts of insulin, so it's going to be very, very safe. So we're going to start with 1 unit. That's probably not going to be enough, and I know that's probably not going to be enough, but that's okay because I know it's going to be safe. So I'm going to send you home. You're going to get your insulin. We'll teach you how to do it. You'll start your shots tonight. I would like to see her back in about a week. And when I want to see her is at that magic 4-hour time. I want to see her 4 hours after your morning shot, whatever time of day that happens to be. That's when I need to see her. And I'm going to check her sugar because I want to see how far it's gone down. It's probably not going to be as low as I want it. We're probably not going to be there yet. That's okay. That'll let me judge. Probably we'll bump up to 2 units. You know, we might bump up as high as 3 units. But we're going to check it and see, and I will always tell you what to do with your insulin. It'll take a couple weeks to get her under control, get that sugar where I want it. And then I'll probably send you home for a month or so to do your thing. We'll check again to make sure it's staying where I think it's going to stay. And then you'll probably go 3 months or so before the next check. So you don't have to, I'll see you a lot for this first couple of weeks. But after that, you're not going to be here that often. And the only thing you pay for the blood sugar checks, which are I think like $28 each. So not a huge expense there. And you pay for the insulin. The biggest expense is the food. It is a more expensive food, but it will allow us to control this diabetes in a way we never ever could before. So it is absolutely imperative that we eat this food. If you need to give her treats, like an insulin time if she doesn't like the canned food, remember that protein is your friend, carbohydrates are your enemy. So if you are eating a hamburger and she's driving you crazy for hamburger, she can have burger, she may not have bun, no french fries. Okay. Carbs are not her friend, protein is her friend. So, you know, if you want to give her a little bit of canned tuna, if you want to give her a little bit of chicken lunch meat, if those kind of treats, you know, she likes to have that, that's completely fine. Protein is our friend, no carbs, no carbs, no carbs. And you've got a couple of cats at home, right? Yeah. So we need to switch, we either need to switch everybody onto this DM food, or we can't have any other kind of food out where she can get to it. Okay. So I think it's always easiest to just switch everybody, and then you're only buying one kind of cat food. And normal healthy cats can totally eat this food, and it's absolutely fine. Okay. The only cat I wouldn't want to eat this is if we had an old cat with kidney issues. It might be a little bit too high a protein for that kitty. So if that happens, then we may not be able to leave food all the time. We may have to do some meal feeding, and then you have to police and make sure everybody's getting the right food at the right time. I know how difficult that is. I couldn't possibly do that at my house. So it's probably easier for all of your healthy cats. Everybody's going to eat this DM food, and that is perfectly fine and perfectly healthy. And so that's what we're going to do. I'm going to have the nurses come in and show you how to do it. Okay. They'll teach you how to draw it up. They'll teach you how to get the shots. My tricks for doing the shots, one is absolutely have something yummy down so that she comes every morning and says, hello, at 6 a.m., give me my treat and give me my shot. And they absolutely will do that. And my other trick for giving a shot to a cat is they're gonna teach you how to pick up the skin, and they're gonna teach you how to do the shot. I like to shake the skin while I'm popping the little shot in, because it distracts them and they never even feel the needle. So it's going to be shake, 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 and pop that needle in.
Okay.
They never even know you're doing it.
Okay.
The great thing about where we do these insulin shots is there's nothing important in that neighborhood.
Okay.
There's no big veins, there's no big arteries, there's no big nerves. There's nothing important you can hit there. So don't worry that you're going to, if you don't get in the exact perfect place, you're going to hit something and the sky's going to fall. There's nothing important there. Just get the shot into the kitty.
Okay.
And I know it seems a little scary to be doing the shots, but in a week, it's going to be like you've done it every day for your whole life, and you're going to be like, this is the easiest thing ever. I've got people all over Fairfield doing this. You totally can do this. What questions do you have for me? Does this all make sense?
It all makes sense.
Okay, good.
I'm not scary at all now.
Excellent. Yeah, no, it really isn't. And she is going to live as long as she was going to live. The awesome thing about cats is they don't get the bad side effects that people get, because you probably, you know old people, diabetics, and, like they get the finger sores and the toes fall off and all these horrible things that can happen to human beings. These things just don't happen to cats. They just don't. I mean, right now we're looking at a cat with blood sugar of 500, and she's sitting here going, hey guys, how are you doing? It's okay. It's not great. We need to fix it. But she's okay.
Yeah.
So this is not going to take over your life. This is not going to ruin your life. And she is going to live as long as she had coming to her anyway. This is not going to shorten her life by one day. As long as we do what we're supposed to do, and as long as we keep an eye on her, and nothing else happens, this is not going to kill her, and you can do this.
Awesome.
Okay? All right. I'm going to get everything together. I'm going to go write your prescription. You're going to take it to Walmart and get your stuff. I'm going to have the nurses come in, and they're going to teach you how to actually physically draw the stuff up and how to actually do the shots. It's very easy.
Okay.
And if you have any questions, and if you want us to teach you again, come back tomorrow. We'll teach you again. We'll practice until you're confident what you're doing, because you're going to do this by yourself tonight, and I'm not going to be there. So make sure you're comfortable doing it. We're going to have you practice. And if you have any questions, and if anything seems like it's going weird, you just call me, and I'll be here.
Okay.
Okay?
Sounds good.
Excellent.
Thank you.
Cat diabetes.